I am Dr. R.K. Mani, CEO Medical and Chairman Pulmonology, Critical Care and Sleep Medicine, Nayati Multi Super Speciality Hospital, Mathura. Rural Connect, as far as healthcare is concerned, is a very important matter, particularly for Indian conditions. Globally, it's a challenge to evenly distribute healthcare between big cities and smaller cities right down to rural areas. Many countries are challenged by their location or by their terrain, and they've been able to overcome these challenges. One prime example is Australia, where the outback region in the middle country is very rough terrain and thinly populated, because most of the population is concentrated in Sydney and along the coast. So they have evolved a mechanism by which medical care can be reached and retrieval accomplished by airlift system, and then creating a sort of medical expertise which is multitasking. A doctor can do surgeries, they can do deliveries, and they can also do serve medical conditions. So such training and such programs have evolved in Australia. Similarly, in difficult conditions like Alaska, systems of retrieval have evolved greatly. In the very cold regions of Canada, the ambulance service is amongst the best. So, although centers of excellence are few, the access to those centers are much better in these conditions, in these countries, than in our country. Closer home, Bhutan also has a difficult terrain and sparsely populated. However, the directly observed treatment system, the DOTS program for tuberculosis control, is highly successful in that terrain, but not so in India. Coming to India, in this context, of course we have been rated very low in the overall healthcare quality, and I think one of the indices is how we are able to reach quality healthcare into the interiors of the country. The reality is that not far from big cities, even 20 or 25 kilometers, there is a sudden drop in the level of care. Much into the interiors, even primary health care is inadequate. Secondary and tertiary level care is indeed completely lacking in many regions of the country. There is access to health care compromised in three different ways. One is a physical distance. For instance, to get adequate cancer care in Uttar Pradesh, you might have to even travel 200 kilometers. To get adequate laboratory service, you may have to travel 50 kilometers. To get a CT scan or MRI, likewise. I think we as a society must address this maldistribution of healthcare. It has amounted to haves and have-nots situation in healthcare. We should get one step closer from the metros into the second and third tier cities to begin with. Improve this access through lifting three barriers. One is of physical distance, another is of infrastructure and technology should be put in place, and third is cost effectiveness. and economic acceptability for large population which are close to poverty line. We must address accessibility, economic accessibility of healthcare through other systems and structure as well, such as low-cost health insurance. We must create conditions for experts to move in to the interiors of the country. It's a lot about people. It's not just about brick and mortar and technology alone. There's again concentration of trained personnel, both doctors and nurses, in the big cities because of lack of infrastructure in the interiors and also adequate living conditions. If we can create reasonable conditions in the interiors, I'm sure many doctors would prefer to stay in their own lands, in their own small towns, rather than try and eke out a living in big cities. Nayati Healthcare is rooted in this concept that we must move towards the people and not stay on in big cities and expect people to fend for themselves traveling long distances to come to the big hospitals. We wanted to improve the access. We wanted to contribute to a new paradigm shift in healthcare, which is moving inward. If we can have low-cost carriers revolutionizing air travel, we envisage a similar phenomenon can take place in healthcare and make it accessible to more and more people. As of now, tertiary healthcare, private healthcare is accessible to hardly 5 or 6%. Out of this, only 30% of people have health insurance. If we can increase this somewhat, increase this proportion in a three-pronged way, going nearer, getting experts nearer, and cutting costs, just like a low-cost carrier, I think we would witness a healthcare revolution. Nayati Hospital has come with a purpose. It wants to tell the people, healthcare is coming towards you. You don't have to travel fast, which means that we are offering comprehensive healthcare solutions. Not just one or two departments, but the whole gamut of specialties. So we are offering full cardiac care, cancer care, kidney and urology, critical care, mother and child care, gynae-obs, orthopedics, joint replacement, to name a few, and in fact includes even smaller specialties such as dental and eye. We have also, for the purpose of completion, included mental health, psychological support and palliative care in this mix. That's an interesting question because there were challenges which we anticipated and some we didn't. The anticipated challenges are that since there is so much demand, so we are going to have an onslaught from day one, which we did witness in emergency medicine and critical care. There's so much trauma, there's so much of life-threatening illness due to infections or due to poisonings or due to heart attacks. They are no less than in the metros. Heart attacks and strokes and kidney failure In fact, there are more. We found that diabetes and hypertension that is uncontrolled is far more in this region. And the resultant complications produce fairly life-threatening conditions. So this was something anticipated, and we had prepared ourselves to some extent. What we didn't anticipate was, of course, how the public would accept modern medicine. The local awareness was such that they didn't know how much resource intensive modern medicine can be. A lot of mutual understanding through counseling had to be done here, more than we had anticipated. We also had to improve the cost efficiency, the economic efficiency of care, fiscal efficiency we call it. Everywhere we went back to our basic premise of making it a low-cost carrier. We went back to find where all we can make it economically within reach to the population. I know the answers are not easy, nor can it be in an absolute sense, but we have been able to considerably reduce the cost burden, even intervention burdens as compared to the metros, because of a greater awareness and sensitivity to these conditions. I think wherever we pay a little more attention, we improve. So I can say that for emergency surgeries, emergency care, we have been able to deliver a high quality care very similar to the premium hospitals in NCR at a considerably lower cost. And then there's more cost saving for the population by not having to cover distances. And they are able to present to the medical profession at an earlier phase of illness, which also improves the chances of salvage and also reduces cost. The way forward for this area is to raise the level of healthcare in all its dimensions. I think attention to the yawning gaps in this region should produce solutions at the government level and at the individual level. At the governmental level, I think there is already increasing awareness and offering of solutions in the form of creating smart cities. I think the government will soon come round to the fact that smart cities have to be possible only with smart hospitals as well. Adequacy of healthcare is integral to creation of such cities. And this message is I think, is being transmitted to the government. So that is at the governmental level. At the individual levels, I think entrepreneurs must see possibilities of investing in this region. They have been very wary of it because of the notion that it may not give the return on investment and the enterprise may not be successful. In this last 6 months, we have been able to allay these fears within ourselves. Even after I am saying great fiscal efficiency, we are able to see the possibility of a viable, vibrant tertiary care center in this region.